Asthma is a killer disease, and people are dying from it every year. As a doctor, you need to know how to deal with it. In this video, I'm going to take you through the key principles of managing an acute exacerbation of asthma. Understand them well, and you will have a solid foundation to really help the next asthmatic that comes to you. There are two foundational principles to the management of an exacerbation of asthma. Number one is to determine the severity of the presenting attack. And number two is to select and deliver the treatment. Determining the severity of an exacerbation of asthma is your key starting point. Recall that exacerbation of asthma comes in at 4 levels: mild, moderate, severe, and life-threatening. When a patient presents to us with an exacerbation, our first task, therefore, is to determine how severe the attack is. To do this, we use a simple but specific process of evaluation. This is how it's done. Step 1. Look for signs of life-threatening asthma. That's right, always start by looking for clinical signs of life-threatening asthma. Not severe, not moderate, and not mild. Start by looking for signs of life-threatening asthma. And if you find a single sign, just one sign, you stop there. You're done. You diagnose life-threatening asthma. If and only if you have made a thorough and careful search of life-threatening asthma signs, but do not find any, only then do you move on to step 2, which is to now look for signs of severe asthma. And if you find a single sign, just one sign, you stop there. You're done. You diagnose severe asthma. And like in step 1, if and only if you have made a thorough and careful search for signs of severe asthma, but do not find any, only then do you move on to step 3. Are you seeing the pattern here? We start looking for the worst asthma first, and we work our way down. Step 3 is to now look for signs of moderate asthma. And similarly, if you find a single sign, just one sign, you stop there. You're done. You diagnose moderate asthma. Now, if you have carefully followed all the steps correctly and ruled out life-threatening, severe, and moderate asthma, only then are you allowed to diagnose mild asthma. So, let's move on now to the second key principle, which is the selection and delivery of treatment. Once you've determined the severity of the attack, selecting treatment is straightforward using this table. The more severe the exacerbation, the more types of medication you will need to combine. For example, steroids and ipratropium are added when the attack is moderate or worse. Magnesium sulfate is added when the attack is severe or worse. And adrenaline is added when it is life-threatening. But everybody gets salbutamol. The severity determines the kind of drugs you will need to combine. This is important to understand. So that's all about the selection of treatment. Let's finish up by talking about how treatment is delivered. The thing to remember is the more severe the attack, the less time the patient has before they crash. You must act quickly and give initial doses of all indicated drugs as soon as possible. Sometimes you may only have minutes. A team approach is best so that all medication can be given in a timely manner. The usual routes and initial doses are shown in the following table. Bronchodilators are the first priority. Regarding salbutamol, the worse the exacerbation, the more frequently it can be given. Severe asthma or worse, for example, salbutamol may be given continuously until there is improvement. Ipratropium is typically given every 20 minutes for 3 doses before being stretched to every 4 hours. And magnesium may be repeated if there is no improvement in the patient's condition. Regarding steroids, hydrocortisone is only indicated if the patient is too sick to swallow. Otherwise, the patient should be given oral prednisolone when steroids are indicated. And that's it, a strategy for asthma management in a nutshell. We'll see you next time.